Simmons, and I will be speaking on compliancy for the morality of healthcare. The purpose of this presentation is to address the proper procedures to be followed by all medical personnel and office staff associated with our establishment, Ashford Memorial Hospital. The overall goal of our medical care establishment is to improve community and public health care and awareness, while encompassing the advancement and training for all personnel and staff members. In turn, we will strive to make our patients' care the top priority by implementing cost-effective methods with top quality procedures and easy access to health care and availability to all citizens. The risk analysis, assessment, and correction techniques. All medical teams will analyze, assess, and correct any discrepancies found in patient medical and personal files. Everyone must take extreme care to enter information into the database correctly the first time. Every precaution will be made to ensure that no mistakes are made in prescription information, diagnosis, and care plan specifications. This includes the doctor, nurses, and all healthcare staff. Security measures will also be implemented and utilized to minimize and/or prevent hacking and unauthorized sharing of PHI, or patient health information, and all data entered into the database. Specific guidelines and laws are to be followed to offset the risk of fines, lawsuits, and any negative feedback for our establishment. Should any unlawful or unauthorized sharing of information take place, law enforcement authorities, whether locally or federal, will be contacted immediately, and all violators will be dealt with accordingly. Next, to cover some government policies that our establishment must also follow. Patient information must be kept secure, confidential, and private at all times. The HIPAA security rule states that patient's health information must be kept accessible to the patient, be correctly entered in the system, and not shared without the patient's knowledge or consent. To ensure the safeguard of all patient information, certain steps must be taken. Electronic health records must be correctly entered into the database. Every person with access must use his or her fingerprint scan to access the computer terminal. There will be no sharing of patient or hospital information without consulting the supervisor who happens to be on duty, and both parties must sign all documents either electronically or manually. Licensures and credentials will be kept current, and staff will serve as patient advocates as needed if no reliable family member is present, and only with the patient's written oral consent. Next, we'll discuss kickbacks, fraud, and Stark Law. Every conscious effort will be taken to ensure that all information remains free from any actions that are deemed unlawful pertaining to kickbacks, fraud, and Stark Law violations. Kickbacks consist of unlawful compensation for referring patients from one entity to another. The anti-kickback statute and Stark Law do allow whistleblowers to report any such acts. In return, the whistleblower is awarded a percentage of the monetary compensation by filing a qui tam lawsuit, and the majority of that money is returned to the government agency. In other words, it is unlawful to receive payment for services when Medicare or Medicaid has been billed for the charges. This is a prime example of violation of the False Claim Act, which prohibits the act of knowingly submitting false and fraudulent claims. And Ashford Memorial Hospital would take every precaution to ensure that none of these violations take place. Another term that we must discuss is the cultural competency of our establishment. In the past, most medical concerns were centered around a person's ethnicity and gender. However, today, and even more so in the future, many other factors will come into play when dealing with patients' healthcare disparities. Among these factors are our medical care personnel will have to know more about the patient's gender, age, mental and physical ability and disability, sexual orientation, and place of residence and living conditions. In addition, access to health care for many of our citizens may be limited due to the lack of income and reliable transportation, especially those living in rural areas. In other words, to meet the needs of so many nationalities, the medical staff will be properly trained to handle any given situation that may arise. Interpreters and translators may need to be hired to offset language barriers. Most importantly, all patients will be treated equally and fairly, and always with dignity and respect. Even in recent years, translating devices have been implemented through the use of computer software programs and newer technology and have proven to work successfully. This concludes the compliance methods for Ashford Memorial Hospital. Thank you.